Rebecca, welcome to Just a Sharp Scratch. I've been looking forward to meeting you and having you on the show. You've gone, like I said, from hospital porter to nursing associate to this newly completing your registrated nurse training,
Yeah.
which is a very serious journey. But before we kind of dive into that, I kind of what I do with all of my guests, and even though this is a brand new series, we're still going to stick with it with this icebreaker question.
Okay.
So I'm going to get you to give me a number between 1 and 150 this time.
134.
4. Okay, I've got to scroll on down. Okay, so this could be a good one. What is your proudest achievement? Which I feel as though we're probably going to get into that in a minute.
Personally or professionally, I probably have.
Let's do personally, because I think we're going to talk about your professional career in a second. So yeah, let's do personally.
Okay. Well, I'm married with 4 children. But we've been together a very long time, so 22 years. I was 16 when we met, and we're still very happily married, and I've built a wonderful life together. So I'm very proud of that.
No, that's amazing. I'm just starting to do some maths now, trying to figure out how long I've been married. That's really bad. But I know that we got married in 2012. So quickly doing some maths, I reckon that must be 14 years. Oh, there we go.
It
I can
goes
do
so
it.
fast.
Yeah, it doesn't it? It flies by, and it's the fact that in about 2 months' time, I'll have a 1-year-old. I've got 3 kids of my own. They're all different ages. He's 11 in a couple of weeks, the eldest, and I've got a 5-year-old and a 1-year-old. So good 5-year gaps. That's what we seem to be having. No more for me though. But no, that's fantastic. Right, let's crack on with the show. So for me, really, it's kind of wanting to talk about your journey, really, and kind of where it all kind of started. So what kind of got you into kind of healthcare, and where did that kind of that passion come from?
It kind of has been gradually intentional. When I was younger, I never really knew what I wanted to do, and I was a young mother as soon as I was 16. Um, but what kind of turned me into the healthcare way was probably deeply rooted from my own kind of experience. When I was 20, I was diagnosed with a very rare neurological condition, and I was effectively paralyzed in a matter of days. It was an autoimmune, very rare. I'm very lucky, I recovered quite well from it. But I was in hospital quite a while, and then it kind of just exposed me to that environment. And like, I remember back even when I was rehabilitating myself, I would help. I remember this little old lady across the way from me always crying out for the nurse, and I was going over to help her, hold her hand, and I didn't really think about it, but you know, reflecting back, I got a lot out of it as well. When I had my third child by the time I was 20. And in my early days, I started in a nursing home, and I loved it. But from then on, I wanted to always kind of do more. Um, but with me leaving school at 14, having no GCSEs, I was kind of trapped. Mm. And then when I started the portering job, that was after I had my fourth child. So I wanted an outpatient, and I just didn't really think about it. It was in endoscopy, and I was like, okay, the hours sound good. And it just completely changed my view, like my drive. And I was so happy. I love endoscopy. Everyone who knows me knows I love endoscopy. And I kind of made that job a bit more than a porter. A lot. I was very much, I've lost my words. I was very much integrated into the team, helping. We had lots of patient flow issues. I would often get involved, try and think of ideas to keep the flow going. And not long after that, my manager kindly offered me to become a healthcare assistant. So I kind of trained up then in the procedure rooms and recovery and admissions. And then it was around that time. I mean, I heard of the TNA, and I looked straight away, and it was like, oh, maths and English. I thought, well, I'm disqualified from that. And then I remember speaking to the learning team about a possible senior healthcare apprenticeship. And she said, why don't we offer maths and English here? We can enroll you. And this was the learning team at work, which I didn't know about. And she said, and then if if you're successful with them, you can apply to be a TNA. So I was like, oh, I don't think I can do it, but I'll give it a go. And I think it was about 4 months, and I passed. I got the GCSE equivalent. So I was like, wow.
Brilliant.
And then the next hurdle was applying, which was a bit of a process.
Yes, definitely.
I think it was November-ish 2019. It was it was kind of like a big, it was just like hundreds of us in a room, different activities happening, then kind of next stage. Then we finally got our interview. And it was exhausting. But by the time I had my interview, I mean, I was tearing up. I think I just got so emotionally involved in how much I wanted it because I knew this was kind of my only way to progress. And yeah, so then I was successfully on the TNA program for well, it was initially for March 2020, but everyone knows what happened then.
Yeah, just a small little kind of virus that didn't really affect many
Yeah,
people.
there's a little problem
No.
there. So then we kind of got pushed back to the September 2020.
But that still must have been hard then, kind of like saying you kind of built up that momentum to kind of think you're going to start in March. And obviously, then all this happened, this pause and kind of what the future was holding. And then obviously, when you went back to do your training in September, what was that like? Because were you able to kind of go into the universities then, or were you still having to stay home and learn?
So I remember I actually left my job, got my gifts and cards from the wonderful team, said my goodbyes, and then a few days later we got an email. So I was like, okay. Um, but I have so many health conditions, and I was actually informed to Shield as well. So I did Shield, and I think it was around August. I actually went back to endoscopy to kind of get back in the mode of work because they did say to me, "Look, you have a choice. You don't have to do this." But I thought, if I want to work in healthcare, it's got to be a decision. I need to make a decision. So I decided to ultimately go ahead. But going back, yeah, it was the university. We didn't, I think for the first year, we didn't go uni. I remember the first time we went to university was for one of our exams and we all just kind of met each other, completely
Really?
disorientated, didn't know where we were going, still social distance. It was very, very strange thinking back. I don't know how I
And was that
managed
the
it.
same with like placements as well when you were during that time? Did you have many placements because of COVID still going on and things like that?
So I had full placements because I was an apprenticeship. So it's like 4-month placements. That's right, isn't it? Six placements in total. And my first placement was on a surgical ward. Within 2.5 weeks, it was the whole staff got COVID, patients, and it was shut down and moved, and we was
Whoa.
off. So that was a great start.
Yep.
Thankfully, I was quite okay with it. It was quite a mild case. So, but yeah, I mean, it was a bit awkward at first because I was mainly at home and only going to the supermarket and like everyone else. And then when all of a sudden I was in work surrounded by all these people, it was like, we have to go near the patients. I have to interact with staff. It was a very strange experience at the time because I was months of
Very much
being
so.
alone. Yeah.
Yeah, because even myself, I had to shield for some time as well because I got diagnosed with type 2 diabetes
Yeah.
in my second year of being on the nursing associate course. And the job that I was doing, I was working in CAMS, which was an inpatient unit. So we had to do quite physical contact with patients, and sometimes with restraints and things like that.
Yeah.
And obviously, with what was going on, my manager came up to me and said that we don't feel safe for you being here because we don't know what it's going to do to you either. So they kind of what they class as medically suspended me, which sounded absolutely awful when you think, what have I done wrong? Being suspended. But no, I got to stay home. And it was, like I said, the moment you were able to kind of go back to work, having that patient contact and having that anxiety of like, hang on, I've been told not to touch people and get close, and now I have to go back into doing it was really a hard step, even myself,
Yeah. It was really
more so
strange.
for you.
It did feel really strange. It probably took me a couple of shifts to adjust and then I soon got back into it. But
Then you qualified as a nursing associate. And where did you stay on the
sorry.
nursing associate route? Did you stay on that nursing associate route when you qualified and stayed? Did you work as nursing, or did you kind of then look and going straight into the registering nursing?
No, I was very happy to be an associate. I thought, this is it. This is, I was quite passionate about the role, very interested in how far it can go. I already decided I wanted to go back to endoscopy, which I did do. And for a couple of years, I was just like, ooh, and learning all the therapies and just, learn about consent and things like that. And I really enjoyed it. Uh, I remember it was a couple of years in, and one of the sisters was like, I need to think of an improvement project. Have you got any good ideas? And there's an area of endoscopy I'm really passionate about, and that's ERCP. And that's where
What's that?
so it's like with the stones in the bile ducts and we remove them. It's
Okay, yes.
it's fabulous. Anyway, so I really like working. That's kind of my favorite area to work. And I've always, since I started as a supporter for the ERCP list, so that's kind of what my first role was. So I've always been quite invested and passionate about how it flows, how it runs. And there's obviously challenges everywhere, but there was a lot of patients constantly being cancelled last minute just due to beds issues, bed pressures, winters. And I was, and then we kind of just like looked around the idea of what could be possible. And we came up with a same day discharge. Other hospitals are doing it, we're gathering the evidence. And it was supposed to be a bit of a silly thing at first, just because we both like TRCP. We thought, let's do a little project. And then we just kind of got really invested. And ultimately, I think it took us a good 12 months, but with a lot of planning, persistence, commitment, we were successful and implemented same day discharge for appropriate patients. And then that was like, oh, we can make changes. And, even as a nursing associate, you can make a change. And that kind of fueled me a bit. And I was like, I would love change can happen. I know you go to places and you say, nothing can change. It can happen. Change can happen. And I think if you've just got the right attitudes and the right people around you who are just as passionate as you, anything's possible, really. And I was just like, I've always wanted to be a registered nurse. So that kind of gap was still there. We're all nurses, we're all nurses in our own different ways. But that was my ultimate goal. And it was the sister, Lucy, she's called, she's wonderful. She just kept pecking at me. You need to go and be a nurse. You're going to be my boss one day. You need to be a nurse. Okay, then. And I looked into it, and obviously, the dream would be for an apprenticeship top up, my own circumstances. I have too many children, but I just actually thought, it's now or never. I'm 38, and then I just looked online and applied and just went for it. Didn't think about it. Just thought, just don't think about it. Scary thought. And then, yeah, I reduced my hours. So I still work at endoscopy, but one day a week. And they're incredibly supportive of me doing this training and flexibility for me with the days. And yeah, February 25, and I can't believe that this summer, touch wood, I'm going to finish.
Yeah,
It's a bit surreal.
congratulations. Yeah.
I'm really excited.
No, that sounds absolutely amazing. And one of the things I wanted to touch on was the said about you were recognized nationally during your training. Was that for during your nursing associate training, or was that during the
Yeah,
nursing
it
training?
was during my TNA training. It's a true story and it's quite funny. I remember coming over from shift, just kind of like waffling onto my husband, like, oh, I'm so tired. Da, da, da. I was eating a Big Mac, so glamorous. And then I was scrolling through Twitter, because I was quite big on Twitter back in then. And then it was like, oh, Student Nursing Times Awards. I was like, oh, I didn't know they did them for students. And it says, now includes nursing associates. I was like, oh, that's wonderful. Scrolling, clicked into it. And then my name was there as like nominated. It was so surreal. I was like, it's the two Rebecca Finches at this university. I was like,
Yeah.
look at that. Does that make any sense? And then I got an email about 30 minutes later congratulating me. I had no idea. So yeah, it was quite a big thing, really. I had to go to London
Wow.
to interview. And then I think it was about 8 weeks later, the actual event happened, and it was a big glamorous event, all paid for, free course meal, wine. And I was a finalist for Nursing Associate of the Year, which was wonderful.
Oh, that's the
I
greatest
was
achievement,
very, I
especially when you
was
think
very
about.
lucky.
And do you know who nominated you?
It was one of he wasn't my tutor. He was like the link between the uni and my trust, who kind of I forgot what they're called, like mentors. And it was because of when I was during a stroke placement, obviously it was COVID, all the shared activities were kind of taped off, they couldn't use them. And I'm a bit of a geek really. I made these workbooks, like for the stroke patients, just little things they can do, pens, paper, workbooks, activities on them, different abilities. And I made like 40 of them. I got so much joy out of making them, and took them in. And it was because of that work he nominated me. Well, they were so well received. That was more rewarding than getting a nomination. It was fun.
Amazing. I bet it'll be a good night. So, what we're going to do now is something kind of new for our series three. We've not done this before, and you get to be the first ever kind of almost
No,
guinea pig when we do it. So it's a little bit of a kind of quiz, which we've called signed, sealed, and escalated. Basically, I'm going to give you 60 seconds on the clock, and you just have to give me your kind of funniest answers that you think when they come to these questions. Going from a bit of fun. There's no wrong or right answer when it comes to it.
gosh,
Right. Are you ready?
think
So
so.
I would, well, yeah. Right, okay, okay. So the first question is, how many times have you heard, so are you trained to be a nurse?
In my nursing associate journey,
Yeah.
it would happen every week, every shift.
Every shift. Oh, bless you. One phrase every registered nurse or nursing associate has said to you.
This will from a registered nurse. Oh, this is so hard. This is a lot harder than you think. It's hard because I want to say something funny, but I've got to be careful.
No, no, you've got to be true now, so go for it. We'll always edit it out. We'll beep it.
Come back to that one. I've gone blank.
All right. Next one. Now, like I say, tea break, myth or reality?
I would say it's often a myth, but it can easily be a reality if you want it to be. You just got to make the time. I always make the time personally.
It always
So
makes I do as well. It's tea. Got to do it. Yeah, NHS runs on tea. The one task that always turns into three.
it's probably just changing a patient's bed. If patients are mobile in bed, it could often turn into 10 tasks.
Next question. How many pens are actually yours?
0. That's a true story. I'm actually looking at one of my colleagues' pens now, and it's one of them fancy Bic ones. So I feel a
On.
bit guilty, yeah.
Go for it. And right. Which has the best gossip, the day shift or a night shift?
Oh, I'd say night shift. They're a bit
Yeah,
more,
I would say
yeah,
so.
they're a bit more relentless with it.
We've got to keep the cylinder going. And we've got one more question before our time is up. Paper notes or digital?
Paper.
Or paper scissors, yeah. Oh, but my problem is it's the writing, just because I can't read it.
For me, endoscopy went over to digital literally the September I went back, and I still find it difficult today. I feel like I'm I'm not directed at the patient anymore, and it's more of a kind of focused on the computer, and I'm turning my head to them. Whereas we used to have like a pathway of notes, and it would be like having a chat and writing. I just feel like it's an invisible an invisible barrier. That's just in our
Yeah.
department the way it works. I can see how it works well on the wards when I do my placements, but I'm a bit old fashioned as well, so I just need to let it go, I think.
My illegible handwriting would just be terrible. Right. So obviously now you're completing your nursing training. What's the biggest difference between who you were as a porter and who you are now?
I think I was quite naive because I had many years in healthcare wards and like the nursing home, and I kind of thought I understood it all. The TNA training would be what grounded me. And I would say that was the difference to me just dreaming of wanting to become a nurse to actually believing I can be a nurse, if that makes sense. Yeah, it wasn't what I expected. And it kind of made me realize what I didn't know. It made me criticize everything, plus myself. But the confidence, I mean, I was confident with patients back as a porter and I loved it. But my confidence now is something I would never kind of have expected from myself. It's definitely made me grow as a person, professionally and personally. But I mean, I think it's quite rare for someone to be truly happy in their job, and I'm truly happy. I can't wait to be done. I'm trying to make the most of the whole topping up journey, but my focus is just this end goal at the minute and going back to the wonderful department and excited about what the future will hold there, really.
And obviously, that nurse that kind of encouraged you to do your training because she wanted you to be her boss one day.
Oh, yeah, she
Do you
keeps
ever
saying
think
it.
that actually kind of might go in that direction? Do you ever think that's what it could be?
That's a scary thought. I think for me, I don't know because obviously managerial, you kind of you lose a lot because you're taken away from ultimately what drew you to that career. But then in the next sense, leadership, managerial roles, that's where true changes can occur, you know. But even as a nursing associate, even as a healthcare assistant, as a registered nurse, you can make changes in culture, attitudes, beliefs, wrote in a positive culture. You know, it's one thing I'm quite passionate about. I'm quite lucky where I work because it is a wonderful culture. And I like to kind of make people see their own potential. There's a couple of other wonderful NAs who have joined since I went to endoscopy, and they're incredible, you know. And for them, they're quite happy being a nursing associate, which is wonderful. I think it just depends on what's right for you as a person. But for me, I feel like I don't know, I'll always be looking for doing something. It seems to be a pattern that's occurring for me. So, but who knows?
No, and it's no, and you clearly care about encouraging others and
Yeah,
things like that.
definitely.
So why does belonging matter so much in healthcare?
The difference, the difference, like the emotions and the behaviors between a team, the difference that can make to patients' experience outcomes is massive. Like I've seen on some poor replacement, shall we say, you know, we've all been in different areas and we can see how differently they work and how that can actually impact patients' experience. But it's kind of hard to put into words. It's in my head, but I've seen it firsthand and I've seen how even just if everybody could say something nice to their colleague every day or encouraging, or just to remind them, wow, that was great what you did there, or you're doing great, keep going. Like the difference that could make. And I've seen it happen because we're all just kind of, we've all got our own lives, you know, we've all got our own pressures and struggles. And I think it's human nature to kind of connect, isn't it? And be a team. But there is definitely a lot of work. I mean, I'm quite interested in human factors and things like that anyway. So, but like I said, I've seen firsthand the difference it can make for a whole patient's experience.
Well, we definitely need more of Rebecca's in the NHS, definitely, and that kind of mentality and that attitude, because I think it would make a massive difference. Because at the end of the day, we are there for the same goal, which is to help
Yes,
that patient, to make them better, for them to go home. And I think that's what we need to focus on, not the kind of politics and the kind of insideness that we have. It's just very much it should be that patient focused is where we should be, and encouraging the staff when they are doing good and not focusing on the negative
absolutely.
side. So that is brilliant to have. So my kind of final question really, which obviously has really nothing to do with nursing associates, but something that we always do for every our guests that come on, is at the end we always ask them for to request a song that we can add to our just a sharp scratch nursing associate playlist, so people can listen to this on Spotify to get them, to encourage them to, if they're about to start their kind of endless fourth night shift in a row, or kind of going that. So what song can we add for you, and why?
Gosh. You see, the problem with that for me, my kind of playlist is soppy is, and I really don't want to add
Well,
one of
that's
them
even
to
better.
that.
Oh no, some Soppy's 80s can be
Oh,
really good.
I don't know. Okay, there's one song of it's nothing to do with kind of me, I suppose. It's just one song that's always been my favorite, and that's "Stand by Me" by Benny King. Absolutely love it. But also, it's a hard. I like the Kate Bush, "This Woman's Work." That's quite a powerful song. So I'll let you decide which one.
Do you know what? I'm gonna be really bad and add both.
But to say
But,
none.
that's yeah, no, yeah, no, I'll definitely add both of those because yeah, "Stand By Me," there's a cover version that, this person does. I'll have to send it to you just to listen to, but, it's
Yes,
yeah,
yeah.
it's fantastic, bit country western style.
Okay.
But no, Rebecca, honestly, thank you so much for spending the late evening with me, and kind of going through your journey. And I look forward to seeing where this goes. Especially like to follow you through and things like that. So it'd be good to maybe catch up and
Yeah,
maybe next
definitely.
series just to see how they're being qualifying and stuff like that. But yeah, thank you so much for spending the evening with me.
No, thank you, Martin. It's been a bit nerve-wracking, but I hope half of it made sense.
It is indeed.
Well, thank you very much.